Hi everyone, my name is Chelsea Ebling and I'm with Unbound Medicine. Today I'm going to introduce you to Nursing Central. We know that your goal as nurse educators is to produce confident nurses who use clinical judgment more effectively. Students who use Nursing Central become those nurses. We also know that you have a number of different options when choosing resources and tools for your students. Today, we will look at some of the differences between eBooks and Nursing Central. I'll introduce you to the resources and tools, and I'll demonstrate how it works. While an ebook is excellent for reading large amounts of text online, Nursing Central has all of these features: exceptional organization, superior search functionality, images integrated with text, integrated resources and tools, and features to make it your own. I'll point out some of these differences during the demonstration. I promise to have you out of here in about 15 minutes, so let's get started. Nursing Central is a collection of resources and tools that can be quickly downloaded to your mobile device and used on the web. It will help your students quickly find information in the classroom, lab, and clinical settings. And it can also help them prepare before class, lab, and clinical. It can help you organize important teaching information as well. Nursing Central is regularly updated and organized for outstanding searchability so your students can find the latest information as efficiently as possible. Once downloaded, users do not need an internet connection for 98% of the application. Access for you and your students include one phone, one tablet, and the web. Today, I'm going to demonstrate on an iPhone, but the functions are just the same on an iPad or similar handheld device. What you'll see today is just a portion of what Nursing Central can do. To begin, Nursing Central includes 4 integrated resources: a drug guide, a medical dictionary, a disease guide, and a lab and diagnostic guide. We also have additional resources that can be added to institutional accounts, and today we've added Nurse's Pocket Guide. In addition to resources, we have a number of different integrated tools to make learning and studying more accessible and successful. Tools include calculators, note-taking, favoriting or bookmarking, in-app terminology or drug lookup, an on-the-go flashcard study system, amazing searchability, and access to nursing journals and the PubMed database. Nursing Central is being used by thousands of nursing students to quickly find information, build a care plan, construct concept maps, complete drug cards, calculate dosage, learn new terminology, and become more confident nurses. I'm switching to my phone now to show you how this will look for your students. Let's say you want your students to collect information to begin building a care plan or a concept map for a patient with hypertension. I'm going to open Tabor's Medical Dictionary, go to Entries, and using this Jump To section at the top, I'm going to start typing in hypertension. Right now, I'm just searching within this resource. When I tap on hypertension, the students can read about normal blood pressure, listen to the pronunciation, and link to additional information. Let's say we link to blood pressure. If a student wants to save this information to refer to later, they can make a note by highlighting this section. Tap on the first word of the section that you want to highlight, and when you drag the cursor, this little menu bar will pop up, and this is where you will access Note. A note box will appear with 3 colors the students can choose to organize their notes. For example, pink for clinical, green for class, and yellow for concept maps. I'm going to make a note for hypertension. When I tap Done, this information is now highlighted for me in this entry. Now I can access notes directly from my home screen by going in through Notes. You can see that note that I just made, and when I tap into here, it brings me right to that topic where I made that note. So When we searched before, we did it through one resource alone. Now we want to search through all of the resources at once. We'll use the universal search bar, which is located in the upper right-hand corner. This allows me to search over all of the resources in Nursing Central at once. I'm going to again type hypertension. Notice that you only need to type in the beginning of the word you're searching to see the options. This is helpful for students learning new terminology and drugs. Ebooks require an entire word to begin a search. Once a few letters are entered, students can immediately see related information all from their resources. If we scroll down a little bit, let's choose hypertension in diseases and disorders. From here, the students can scroll through the information, or they can utilize the sections menu, which is located on the bottom right-hand corner. From here, they can jump to a specific section in this entry. Now we'll choose causes. Searching through ebooks can be just like searching through traditional textbooks. Nursing Central offers multiple fluid search options. Getting the information efficiently is one of the ways Nursing Central helps students feel more confident and work effectively. So let's say your student is reading through the causes and see a word that's new to them. We have a great tool for that. Say, I don't know what hypercalcemia means. I can highlight this word. The menu bar will pop up, and this is where I can utilize Glimpse. By choosing Glimpse, it takes me directly to Taber's Medical Dictionary to the definition of the word. You don't have to leave the record you're in to find the definition that you need. Glimpse will take students to answers in the trusted resources that you've chosen. Medical terms from Taber's Medical Dictionary and drug information from Davis's Drug Guide. This is important to note because sometimes ebooks include a lookup feature that will take users to Google for information. We know that that information is sometimes incomplete or outdated. At the very least, it is not information that has been vetted by your school. So when I'm done reading through the terminology, I can tap done and I'm back into causes in hypertension. Before moving on, I'm going to tap the star at the bottom of the screen. This is a favorite. By using favorites, students can organize and save important records that they might need for their care plans, concept mapping, or new drugs that they're learning. Moving forward, your student might want to know what drugs are associated with hypertension. By using crosslinks, those two stacked arrows at the bottom of my screen, we can find information associated with this disease. Crosslinks looks through all of the resources at once and presents users with interrelated information. Another powerful search tool only in Nursing Central. We'll tap into the first drug and we're immediately in the drug guide. Davis's Drug Guide provides the generic name first, in addition to images, pronunciation, associated information, and trade names. As I mentioned, Davis's Drug Guide is updated frequently. Unlike an ebook, Davis's Drug Guide on this platform offers quick filtering, in-record images, important charts, better readability, and integrated calculators. Students can also search by the generic or trade names and only have one drug per page, so there is no confusion when scrolling through the information. While we're here, we'll favorite this drug as well. There's also integrated calculators in the drug guide. The calculator icon is located on that bottom menu bar, and when I tap it, it brings up a bunch of different dosage calculators. Since the medication we are currently looking up is a by-mouth solid, I want to go into PO dosage solids to calculate the dosage. From here, the students can enter the dose ordered and the dose per tablet and calculate the dosage. Underneath the calculator, there is the interpretation and the formula as well. Here, the students can better understand the equation and how the dosage was calculated. When I tap the back arrow in the upper left-hand corner, it brings me right to where I left off in the drug guide. Nursing Central is fluid and intuitive with navigation. So I'm going to use that back arrow at the top again to bring me back to the crosslinks in hypertension. Now we want to check on any labs associated with this disease. So I want to look for something in the lab guide, and as I keep scrolling, there are more. So now I want to tap into triglycerides. Now I am immediately in Davis's lab and diagnostic tests. Here, students can check the normal and abnormal test results, the rationale, see charts, and more. For good measure, we'll favorite this one too. Lastly, we want students to know the accurate nursing diagnoses. I'm going to go back to the home screen and go directly into Nurse's Pocket Guide. Again, we'll look through hypertension through topics. Here are all of the associated nursing diagnoses. They're listed here, and it has a link which I can tap for more information. You can see the images on the right-hand side. Those represent the nursing specialties. I'll tap into the first diagnoses, deficient knowledge. Students will be able to read about defining characteristics, desired outcomes and evaluation criteria, and most importantly, actions and interventions where the nursing priorities will lie. We'll favorite this final piece of information. Now that we've walked through some of the ways students are able to look up information quickly and efficiently, we've checked out some of the causes of the disease, looked into any labs or tests, looked for associated drugs. In addition, we used Glimpse to look up a definition, the calculator to find dosing information, and we even took a note to refer back to later. All of the information that you favorited is now saved for you on the home screen. Nursing Central includes a number of features to organize notes and favorited information to make learning and studying easier. Remember, some of these features are even great for educators too. It may be helpful to favorite or take some notes of information you want to use in the classroom, or even refer quickly to check yourself. Everything that's available on the web is Everything that's available in the app is also available on the web. All of your saved information is carried over. Resources, tools, and searching are the same, and there are even more tools on the web as well. Nursing Central has helped thousands of students and educators, and we're excited to tell you more. We do have a few moments for some questions. And it looks like our first question is, I would like to share this webinar with my colleagues. How do I do that? We will make this available in YouTube shortly, but we are also available to do private webinars where we can show you all that Nursing Central has to offer. Another question is this available only to students, or can instructors use it as well? With our packages, access is available for students and educators. And many educators do use Nursing Central to keep track of notes and other information. A final question is, do you offer student training? Yes, we do. We have live training sessions that we can tailor to your program. We also have additional videos available in the app so students can review information, and we also have a dynamic support team ready to answer any questions you may have. There is so much more inside Nursing Central: a study system, access to primary literature, journal tracking, and more. If you'd like a personal tour of our product or to learn more about any of our resources, please contact us. Thank you so much for joining us today.